Hi, so this is for discussion number 6. The first question, what might make it difficult for you or other team members to stay present in a healing way with a patient like Jenny and her family? I think things that can make it difficult in Jenny's particular situation, first of all, is because especially the PA that was seeing her, obviously who was short on time, and as we all are. And so that could make it difficult to care for her, especially since it seemed like her being there was kind of inappropriate, since it would be better served for her to be in hospice. Another thing that would make it difficult was the family division that the chaplain mentioned, or that the PA mentioned in part 2, that Jenny's side of the family was for wanting her to be sedated and comfortable at the end of her life, while Jenny's husband's side of the family wanted her to fight and was praying for a miracle and kept trying to wake her up to talk to her, and wasn't sure if they wanted her sedated because they weren't convinced that her life was coming to an end. So that is, having those two families divided would make it a little more tricky to care for her and for them. Because you would want to be careful what you say, because you don't want to upset either of them, and that's something that they both would have to be educated on to make a decision together in Jenny's best interest. Another thing that would make it difficult for us to care for and be present in a healing way for Jenny and her family is that, especially in such tragic situations like that, we tend to distance ourselves, especially if you are dealing with patients and their families like that every day, that it might be, very taxing and just draining, and so it might be easier to distance yourself so you're not as sad every day. The last thing that I wanted to mention that would make it difficult to be present in a healing way is that the family misunderstood about the pain control. They thought that bringing her to the hospital, they could get more pain medication for Jenny and make her more comfortable. And as a PA said in part 2, that she could actually get more pain medicine and better pain control in hospice, but it does have the effect of making her more sedated. And so that is something I think that either the PA needs to go back, or a couple of the team members need to sit down with the families and clearly lay out the options and what she can get out of inpatient and hospice. A story from Riemann's book that I think fits with Jenny's situation was a story, When Somebody Knows, and Rachel had mentioned that she was having a lot of distressing symptoms, and she went and visited one of several doctors that she saw, and this one was Dr. Smith, who was a surgeon, and she knew that because of HMO, she only had 15 minutes with him. So she pretty much expected for him to be in a rush and not be able to do anything and not care about what she had to say. But Dr. Smith listened to her story, and I think that's something that, especially Jenny's family, was, they just wanted to be listened to, and they weren't sure if the PA was really listening to them and understanding their concerns. And Dr. Smith was able to show her that he listened to what she had to say, because he asked questions pertaining to her symptoms and her story, and he validated her concerns. And I think that's something that the PA, he did a good job in his interaction with the family, but I think that's something that could have provided more comfort to Jenny's family, was validating their concerns. And the surgeon at the end, he said that even though he didn't know what was going on with Rachel, he said that he would be there and that they would wait together to find out what was going on. And so I think that's something that the PA, also didn't, wanted someone to be there with him, which is why he was consulting the chaplain, which is such a kind of positive of like a team-based health team is because the PA doesn't have to try to solve this or work through this all on his own, but also that him and the team can show Jenny and her family that they're not alone at the end of Jenny's life. Moving on to question B, if you were the PA or one of the team members caring for Jenny and her family as she faces death, in what ways could you seek to promote right protection and a place of refuge for yourself and the team of caregivers? So one of the stories that I read in our Readings and Reman's book for this week was called A Place of Refuge, and I kind of like this because it spoke of finding a place of refuge, and it really mentioned the power of silence and how silence, especially in these cases, isn't us hiding or running away, but it's us going and finding a place of strength. And that especially in the end of Jenny's life, that just kind of being silent and not trying to fill every minute with words, and being silent with the family and acknowledging the seriousness and the tragedy of what's going on and what they're going through could be a way to show that we care. And I think an interaction with a chaplain is a potential source of help. I think that's always a good idea when a patient is facing death, and especially since with the family division in Jenny's case, I think she could help, especially Jenny's husband's side of the family, who was very religious and is still praying for a miracle. And I think that she could help them all find peace in this situation. Thanks.